Hey guys, wanted to come on here and do a video. Um, I don't know. I was thinking about it on the way over here to the hospital. I came a little bit earlier than I did yesterday, because I got an update from my husband telling me that they found an ulcer on the bottom of his foot, close to where his pinky area is. I posted that picture so you guys could see it. I don't know how it went from pneumonia to the kidneys to this, but maybe it was a blessing, because we've been just so busy trying to go through life and just, the pressures of life and just trying to do the same thing every day. Hubby go to work, I stay home with the kids, trying to just make ends meet like everybody else. Just going. And sometimes we don't take the time to pay attention to little things. So I wanted to do this video to kind of remind you to kind of slow down, and to remind myself to slow down and pay attention. For the past couple of days, hubby hadn't been able to sleep with me on the bed. He has a lot of leg pain due to neuropathy. And I was sharing with our bishop. He's like, why can't he sleep on the bed? I'm like, I don't know. There's just something about the bed that causes him to have this really severe leg pain. But when he sleeps on the couch, he doesn't have that pain. So sometimes what he does also, like if he does want to sleep on the bed, he will put he'll open a drawer, and that stresses me out, and I don't like it when he does this, but sometimes he'll just do it anyway. He puts his foot on a drawer to kind of, I don't know, that's just what he says makes him feel better than putting his leg completely on the bed. And he's like, our bishop asked, is it because it elevates? It's not really that he's elevating, because it's it's the same. It's not higher. In my opinion, it's not higher. It's the same. It's just, I don't know what it is. Maybe it's the pressure or something that bothers him from the bed. I don't know. But anyway, the point is that I was checking his feet constantly, because he had other wounds prior to this a while back that I was trying to take care of, like last year. And I had so many wounds to take care of without a doctor, without a hospital. I'm just so used to always taking care of these wounds for him. And God provides for us, and he always gets these wounds healed. And so I missed this one. And I hate it, because it makes me feel like I missed it, right? And nobody likes to feel like that. But hubby's so sensitive. He has to be wearing the proper shoes. He has to be, constantly in balance with making sure he's walking, making sure he's eating right. Diabetes is so difficult to manage, especially with him. He's the kind of person that one small little cut can turn into a really big problem really quickly. And so I constantly have to be checking on him and being on him. And sometimes I feel a little bit like sometimes I act like his mom, and I'm constantly on him, like, don't eat this, don't eat that, don't drink this, don't drink that. And it's it becomes very overwhelming and very tiring to constantly be after somebody. And I appreciate that he's very receptive and just does what usually I tell him to do. And it's taken me a long time to get him to do what he's supposed to do, because he is quite stubborn. And unfortunately, we live in a time where, we're led by lusting after food, and, food looks great, and you you just are enticed by food or by sugary drinks. And, it's been a really hard journey to deal with an addiction. My husband used to drink before, and so he stopped cold turkey and ended up going straight into sugars. And so he would drink like a lot of sugars and things. And so I think that has been something I've had to deal with, being married to him, having to deal with, that. The fact that, he likes to eat, he likes to drink sugary drinks. He's done really good with the sugary drinks. He hasn't had sodas, and he doesn't, once in a while he'll get a sparkling drink, or, he'll get a Powerade or a vitamin water or like something like that. But just to kind of like, keep him sane. But yeah, I constantly have to be over him and checking on him. And I missed it. I missed this ulcer. And honestly, if we wouldn't have brought him to the hospital, I probably still wouldn't have known. Yesterday when I came over, I did smell like a really strong odor from his feet. And I just was like, you need a shower, so I made sure he showered and everything, and got him everything, asked the nurses to like take care of the IVs, cover them up, and I was still seeing that, I was still feeling that strong smell or whatever. And so I made sure he had soap and all this stuff. But when he was like taking off the gown and everything, and I was in the restroom with him, I looked down at his feet and I did see a little bit of redness on the side of his, but he had asked me for some sandals, and I thought, well, maybe it was the sandal or something, right? And so I kind of just, I didn't bend down because I'm super careful with my back. And sometimes I worry that if I bend a certain way, I am not going to be able to get back up. And so that fear that I have of sometimes bending over keeps me from checking him. And, and people are coming in and out doing all these, things, like the vitals, and sometimes things just slip, they just slip. And I know I can't be like living with guilt all the time. I know I'm going to miss something at some point. I can't be at everything. And I know that I have to like allow other people to step in and help. And I so appreciate it. I have learned through my journey with taking care of my dad and taking care of my husband that I too have to take some time to rest. Because if you don't rest, then it also affects you. And so I've been coming, I stay the entire day with him, but then I go home to rest. And it allows me to think clearer and tackle the day better. And when I was doing that with my dad before, I just was going. And when I've done it before with my husband, I was just going. And so we fall into this thing where it's like, then you start falling apart. And so like, I am exhausted with so many wounds that my husband has had. And I don't know why, I've been doing my scripture study a lot lately, and I just feel super confident that I know that, God is going to intervene. He's going to take care of whatever it is. And so I'm strong in that sense. And I don't cry because of that. I cry because you kind of feel down that you missed something, and that it could have been prevented if you just paid attention a little bit more. But like I said, it's just been like just going. So I wanted to make this video because I want to remind you all to not just go. Pay attention. You might miss some things, and you can't carry that guilt with you. Like I can't carry it. It is what it is. I'm here. I'm in the situation. Maybe God intervened and wanted me to pay attention. And this is probably the only way to get my attention and his attention. But the thing with my husband is that one small thing can turn and blow up into something really big. And so as I was doing my scripture study, I don't know why I kept thinking about we had gone to go visit my sister-in-law, and my brother-in-law on my husband's side too had a procedure done, and they were able to, they dropped a lot of weight. And my brother-in-law did state that, he doesn't have diabetes anymore. And so I never really thought about it before up until now. During scripture study, I don't know, I was thinking, a lot of this would go away if maybe he did, because he does need some help and I think somebody needs to step in, because I'm exhausted. And I think he's exhausted with so many scars on his body, maybe because he can't have the willpower, and it's nothing to be shameful for. I don't think a lot of us do have the willpower to, what they say is like, obeying the word of wisdom. We practice that a lot, and we know that we need to take care of our bodies because they are the temple and the body God gave us to just protect. And that's where our spirit lives. And we need to be mindful of it. We need to protect it, and we need to feed it and nourish it the way it needs to be and take care of it, mentally, physically, emotionally. We need to take care of it spiritually, constantly feed it with scriptures. And, because if not, the world will take you on a really crazy spin. And so I was thinking that it just kept coming to my mind about maybe like doing the gastric bypass or whatever. I don't really believe in surgeries and like things like that. But, or this, like the sleeve, I'm not really very educated on that. But I know family members have done it in my family and on his side of the family. And maybe that is an option. Me personally, I met my husband thinner, and he was very athletic, and he was constantly working out. But when we started dating, he just started, we started being happy, and we started gaining weight. And so was I. I was thinner when he met me. And you just get happy, and you kind of just like, meh, you kind of give up a little bit on all that stuff. And so he kind of gained a ton of weight. And when he became diabetic, he dropped 100 pounds. Diabetes ate him up, and so made him really sick. And then we got back on the journey of working out and losing weight because we got on the Gerson therapy. And I lost 50 pounds, and he lost a bunch of weight, and we were thinner again. And then you go back to old habits, and you gain the weight, and then you get sick again. And what happens? You go back to taking care of yourself. So it's like this roller coaster ride where you're just going back and forth with it. And honestly, like, I'm just so tired about this and about constantly acting like his mom. I don't want to be a naggy wife. Something my dad always told me is don't be a naggy wife. Like, men don't like to have a naggy wife. And I do not want to be that at all for him. I want him to know that I do it from love and to take care of him. And because I have a medical background, and because I've been through a lot with my dad already, and I've helped with a ton of wounds already. I have so much experience with wounds. So I feel stupid. I feel really stupid when they catch me on a mistake, because I know better. I know how to treat them. I know how to take care of them. And God has always been by my side. I don't have a certificate in it or anything, but I learned how to treat wounds since I started working at the nursing home. I would go alongside my best friend, and she was a treatment nurse, and I learned a lot from her. Then having to take care of my dad, having to take care of patients at nursing homes, and working at doctor's offices. I have some knowledge in the medical field. I should know better. But like I said, things slip away. You can't be at every single moment of my husband's life. Like I am my own person. As much as I want to be, and knowing every single thing, I can't be at every single part of his life. I'm his wife, yes, but I'm not attached to his flesh. And I don't see the pain that he sometimes has, or he cuts himself, or he made a mistake. And I think the biggest thing for him is worrying about how I'm going to take things, like, because he doesn't want to get in trouble for cutting himself or hurting himself. And so because he probably feels that way too. Like, I should have known better. Or I should have taken care of this, or I should have taken care of that. Things happen. And something that happened here at the hospital was I kept hearing him say, "I'm sorry, babe. I'm sorry, babe. I'm sorry, babe," when he was in the ER. And I'm like, you need to stop saying you're sorry. Like, it's not your fault. Like, things happen. Like, you just kept apologizing to him. Like, you need to stop stressing out. Like, it is what it is. Like, we're here. And so I want you all to know that sometimes, bad things happen and you end up in the ER or whatever. But sometimes it's because God is trying to call your attention, and he's trying to make you understand, hey, pay attention, And I could be paying attention to him scripturally, but I'm slacking on another area, And so that's where I find myself trying to find balance, just like my husband's body tries to balance and has a hard time balancing. I have a hard time balancing. I have a hard time being a mom, taking care of my kids, taking care of the home, taking care of my husband, taking care of myself. And I've been working so hard to take care of myself mentally and physically. And I try to take care of my kids, but it's like, I'm never going to be able to take care of everybody at the same time. I need God to step in. And I'm not crying because I'm sad or hurting or anything. I'm just finally realizing that we need help. We need help in the sense of constantly being in tune with him. Because I was the kind of person, I can fix that. I can fix that. I can fix that. I'll take care of it. I'll do this. As a mom's, we're that. And I already have that kind of character in me because I learned it with my mom and my dad, that I always had to be, on top of things. I always had to try to be perfect. I was always a people pleaser. And so I already have that attitude. But, God's been trying to teach me a lot of things. And I'm not worried about him not showing up for me, because he has. He really has. That's not where my fear is or my stress is. It's just kind of I get it. This time is different. I get it. I need him. I truly need him. There were times where I felt before I don't need you. I would get angry because things wouldn't go my way. And that was mostly with my dad back then. And I remember saying some harsh prayers because I would get angry, and I wanted my dad to heal, and he wasn't being healed. And I got angry one time and I said, fine, it's going to be your way. It's going to be your will. And I remember when I said that, something snapped, and I got a blessing from him at the hospital. And that kind of just stuck with me. And taught me a lot. It taught me a lot about learning to be humble. And sometimes we don't know why God does things, right? Or allows things to happen. But we need to trust that he knows better. Because honestly, if I wouldn't have had the trial that I had with my dad, I wouldn't have had all the blessings that came with it. There was a lot of pain, but there was a lot of beauty in it. My dad got to see the way we served him. My dad got to see how much we loved him. He got to see. I'm sorry. I'm trying so hard not to cry. And like I said, I'm not crying because I'm in this situation. I'm not crying because I'm crying because I finally understand that bad things happen sometimes for good. Because honestly, if this wouldn't have happened, I probably wouldn't have caught it. It probably would have gotten out of my reach. And so I'm glad that I'm here at the hospital. I'm grateful for him stepping in because, we weren't paying attention, or we didn't catch that. And so he is at the right place, and they've been able to take care of him. And I'm so grateful for being able to be here either way. But like I said, I wouldn't have been able to learn all the things that I did with God if I wouldn't have gone through all these experiences with him. So like, I truly know the character of him, and I know that certain things happen sometimes for our good. And I don't know why my dad had to have a stroke. I don't know why that was a part of his journey, but that is a part of his journey. That was a part of his journey. And so, but there was beauty in it. There was painful moments. There was a lot of humbleness. There was a lot of learning. There was a lot of dedication. There was a lot of getting closer to God. And that's why I stay close to him, because I need him. I need him in my life. I constantly need him, because it doesn't matter what any doctor says. Sometimes God steps in and something can just change in an instant. Like my life changes in an instant. One moment I'm reading my scriptures, the next moment I'm here at the hospital. So life will take you all over the place. But as long as you know God is there, and, you know, he has healed a ton of wounds before, I'm pretty sure everything will be okay. And, you know, I'm here. He provided everything for me to be here. Luckily, right now I have gas. I was thinking about this yesterday on my way over here. I was like, I have gas. I have food at home. My son is 18 already. He can, he's an adult. He can take care of things that I need him to take care of. My daughter is pretty mature. Back then, when I had to do all these things, I had little kids, you know, and I would worry. They were constantly in lobbies, cars waiting for us while we took care of doctor's appointments. You know, things are different now. And yeah, I just know he's with me. I know that he's providing every single little thing, even to the very last bit I need. So that is my reassurance, that I know that everything's going to be okay, because he's providing everything that I need. And that's the difference that I feel today. And maybe back then he was doing the same thing, but I wasn't seeing it as clearly as I am now. And I just think that getting to know him and doing scripture reading and scripture study, like just trying to stay close with him, I think allows me to see better. And so I encourage you that if you're going through a strong or a hard trial right now, for you to read your scriptures. It'll help you stay close to God, pray, you know, be mindful, check up on your family members and make sure they're doing okay. I'm fine. Yeah, I cried, but that's not why I am crying. Like, I'm not giving up or anything, you know? I wear this little necklace I have that says never, never give up. This was given to my daughter. Some lady, when I was asking for like broken jewelry and like yarn and stuff like that for my daughter to become, you know, super creative and stuff. This came in one of those little jewelry boxes that she gave, and I kept it. My daughter is like, she gave it to me. She's like, Mom, I know you're into stuff like this. It just says never, never give up. And so I wear it constantly because I always want to remember not to give up. And not that I need a reminder, because I have it in me, but I just wear it because I feel like it's important to wear things that make you happy and things that bring you joy and remind you, you know. I don't worship it or anything, but I wear things now. It helps me mentally too. And emotionally, I wear things that bring me joy. So like this one, I like how it sparkles. And so I wear my little earrings. This I wear because it reminds me like to never, never give up, and to like kind of let other people know, like if they look at my necklace, hey, don't give up. I always wear my little butterfly bracelet, but I didn't because I love butterflies. And so I do things that help me out now. I do things that bring me joy too. I don't just constantly just do for others like I always have. You know, God knows I always have served and tried to do things for people. But lately, I've just been working really hard to take care of myself too, because I learned that I was breaking apart. I was a mess. And so I hate talking about it because this happened. See, I'm trying my best to keep myself. So they're not, they're not usually there unless I feel like very spiritually, how can I say it? I've been working really hard to stop that, the crying too much. Because I would only get like that when like I felt super overwhelmed or when I would think about my dad. So I'm still trying to work through that. But it's hard. A lot of people think it's easy because it's like, you know, just like move on already, right? But it's hard because I miss him. Not because I don't know he's okay. Of course I know he's okay. It's just I miss him. And so he taught me some of the greatest lessons I needed to learn in life before his stroke and after his stroke. And I miss his laugh. And so every time I come to places like this, it kind of just, it reminds me, you know, I used to know all McAllen Medical. I used to know every single button to push, every single hall I would walk. I mean, I knew that place. And yesterday, I'll tell you that I came here. And I've been here before, just mostly to the ER, like with my mom or my husband and stuff. And I've been to the other side of the hospital where Rudy would get his antibiotics and stuff. So I know some of the areas, but this is a new hospital. And it's really great. And they attend you super well. The customer service is great. And they're fast in what they do. And so I have a lot of confidence in it. But I'm not going to lie. Yesterday, I felt like stupid because I was going in through the main entrance and I was talking to the person that was like checking me in, and he's like, okay, what room are you going to go to? And I said, okay, I said my husband, and then I told him the room number, and he's like, okay. He's like, I'll pray for your husband. And that like kind of hit me, right? I'm like, oh, thank you. And he's like, every prayer counts. And I'm like, yeah, they do. Thank you. I appreciate it. And so then I was trying to find the button to the elevator, and I don't know. I felt stupid because it was right there in front of me, but I wasn't reading it. I wasn't being observant. I guess because my mind was everywhere else. And I'm like, what button do I press? I wasn't reading. And so when you're in situations like this, sometimes you're not thinking clearly. You can think of a lot of things, but not even, sometimes you miss the simple things. And so luckily there was a label on the elevator button that said, I don't even remember what it said. Should probably take a picture of it, but it said like elevator button or something. It was so stupid. I felt stupid, and I'm like, oh, okay, here it is. So it's like God provides all like the little details, even like a little thing for me to like, hey, this is the button to press. So I pressed it, and I go up. And as I'm going through there, you get to a lobby, and I'm like walking out of the lobby, and then I'm going through the hallway. And the first thing I see is a bed that my dad used to have at the McAllen Medical Center. And it's like, just like, you know, I'm walking these halls again, and just kind of reminding me of the bed. Looks like my dad's bed. And so I'm like, Lord, please help me. Help me get through my day. You know, help me do the things that I need to do. And so I just keep walking and, you know, making sure that everything's right. Make sure my husband's showered. You know, put on a new gown. You know, I talked to the CNA. I remember that with kindness, a lot of things happen. So she started doing all the little extra things. I just said, how's your day? And she's like, oh, it's good. Like, she was just waiting for me to ask something. And so then we just started talking. She's like, what do you do? And then we started talking, and she was super sweet. She brought me extra water and ice and with a smile. And she's just so amazing. I told her about my kids being homeschooled. She's like, oh, wow. And we just started talking, and, it was super nice. And kindness definitely goes a long way. And I try to have a lot of kindness, That's why I said it's different this time. Because before it could be more demanding. It could be, well, why didn't you do this? Why didn't you do that? And it was a lot of prayer, because sometimes when you see wounds and you see the person you love the most hurting. And I remember coming one time from church, and I had the opportunity to go to church that one time. And I remember just praying and asking God to please, that when I got to see my dad at the hospital, that everything would be done, and that everything would be clean, and that I didn't have to get angry, and that I didn't have to be upset. And as soon as I walk in the door, the shades were up, the blinds were up, everything looked so bright and airy. My dad was clean from head to toe, like they had just cleaned him, because I had been angry prior. I had seen him with so many wounds and not changed and dirty, and I was angry, and I was like so upset. And I said, how can they treat the person that I love the most like he's nothing? And I said, I'm sorry, Dad. And I got to work. I'm like, I have the schooling. I've done this before. I can do it. And so I started doing everything by myself. And I remember that the nurses were rushing, and the CNA was rushing. And she's like, I'm sorry, ma'am. But I was already doing things because I was angry. And I remember washing his feet. And I felt like the story of like Jesus when he's washing the disciples' feet. I felt that so strong at that moment. So that's why I say that experience that I had with my dad gave me so much strength, and it just taught me so much. And so that's why I'm so close to God, because I've walked with God. He has shown me more than anybody else has. And that's why I lean on him. I appreciate everybody he sends me, but I know where my faith is, because he's brought me through so many things. Even when doctors didn't think, certain things would work out, he made a difference. He changed that. And so I lean on him. Like I said, I don't cry because I'm like in the situation right now. I'm not. I know I'll get through it. And as much as the one down there wants to pick on me and wants to bring me down, I know where I stand. It's not why I cry. I cry because of memories of the things I've had to go through, and I miss my dad. And I don't cry because, like I said, I don't want my husband to think like he has to be sorry for this. This is out of his control. It's something that happened. It is what it is, and we're gonna get through it. I'm strong. I don't, I cry because I have like what they say, PTSD. Every time I step into something, it just reminds me of things, or like if I see a wound, or like just familiar things that I've gone through. That's what causes this. And so I'm really trying to work on myself and strengthen myself to not have this crying thing. I don't know if it'll ever stop, but it allows me to release whatever it is I'm carrying inside. And I'm not crazy. I just have a really strong connection with him, with God. And I guess sometimes maybe he wants me to share it. And on my way over here, I was like, I'm just going to do a video and I'm just going to share this. I feel like people need to take a moment and evaluate situations. Don't just go. Obey the word of wisdom, do a lot of scripture study. Even here at the hospital, that's where I feel closer to him, because I started studying my scriptures. And I used to do the same thing. Even if I wasn't attending church, I was studying my scriptures. I've read every single president book that had to be, that was out. I read my scriptures. I know so much. I know so much, believe it or not. And people might think otherwise, but I don't, because I have been so close to God. And I am close to God. I'm not perfect, but I know the walk I've had with him, and he does too. And he knows every single thing about me. And so I am strong. And so is my husband. And I know he loves him. He's been healing him. I know he has a purpose for him. I know that deep down inside. And that's why the devil hits hard and things happen. And he causes us to get confused. And sometimes we don't pay attention to the things that are important, like taking care of our bodies, because he makes us lust after food. He entices us with temptations. And sometimes that causes us to not see clearly. And then we end up in places like this. And unfortunately, that's what happens. We can't be lusting after things. We need to be a little bit more mindful. And I know we have breaking points where we get stressed out and we want to reach for sugar. But we need to try to be better, and we need to try to do better and think higher and think, what does my body need? How can I be better? Pray to God to help you get through those lustful times, or those addictive things in our lives that we need help with. He'll step in, he'll help. We just need to ask. And so that is where I'm at. I am just realizing through all this scripture study, and I can see super clearly that he is still working in our lives. And it might seem like a bad place to be in a bad situation, but I don't see it that way. I see it like he stepped in to help me see something I missed. I didn't catch, or my husband didn't catch. And so I'm here. I know better. And we just gotta keep going. We gotta keep praying. Trust that he'll come through yet again. Stand firm and speak up. It's something I had to learn so much, taking care of my dad and having to take care of Rudy. I had to speak up. You can't just allow people to do things without your consent. And so, because they too miss things. They're human, just like I am. I miss something. My husband missed something. Sometimes they miss something. And speaking up is important. But when you come with experience and you come from countless times where God has helped you heal these wounds, they also need to take that into consideration. They might have a degree, but I have experience. And sometimes experience can overrule the title. And so I might not have a million titles, but I have a lot of experience. I have a lot of experience with God, and I have a lot of experience with wounds. And I've gotten my husband this far with God's help. Never forget, it's always been with God's help. He gives me the understanding and the will to do it. I'm willing to serve my husband. But I don't know. I just feel like something to explore, maybe the whole sleeve, the gastric bypass or the sleeve. I think it's something to explore, just so that, and I know that that's a risk. I know it's a risk because they have to, go in and put something there. And, my aunt had an issue where she almost lost her life because of the band. I mean, I know there's a lot of things to consider. That's why it's important for us to have strong will. And we have free will, but we need to remember that to have strength to overcome things. So it's either he learns, like Dr. Valencia says on Facebook. I just started watching him, and he tries to help a lot of people, and he tries to treat everything naturally. He doesn't believe in medications, and he always says, because somebody asked him, and I'm sorry, it's going to sound bad, but he told the person that was watching this or reached out to him, Doctor, what do you believe? I'm going to say it in English, and then I'll translate it. He says, doctor, what do you believe about the gastric sleeve or the gastric bypass or whatever? And he was laughing. He's like, no. He was saying no. And he said, mejor, like, learn to close your mouth. Now I'm going to say it in Spanish, and it sounds way worse, so I'm sorry. But he said, they had asked him, doctor, ¿qué piensa usted del gastric, el bypass or el sleeve or whatever? I don't know how to say it in Spanish. Gastrica, I don't know. I'm not even going to try. And then he said, no, ciérrate el hocico. So he's basically saying, learn to shut your mouth. Learn not to eat so much. Like, if you learn to eat better, or you learn to shut your mouth more, don't eat so much. And so that always stuck with me. He says it a little ugly, and that's just kind of how, like, my dad would talk, but it would stick. And so I think sometimes we need a little bit of help in that area, and people speaking to us a little bit firmer. Firmer sometimes sounds ugly, but it kind of like makes you click. Sometimes we can get offended, though, when people speak to us firmly. And especially with women, you got to be careful because we get offended quickly. But for some reason, the way my dad would speak to me, it was firm, and sometimes wouldn't use the nicest words, but it just stuck. And so I think sometimes we need that. I've been trying to do that with my husband. I've tried the nice way. I've tried the harsh way. And it's like, it's not working sometimes. So it's like, I know he's trying, but unfortunately, it's not working. So we need to find another solution. But that's what was coming to my mind. So I don't know. I'm going to explore it, talk about it, see what the risks are, and then see what he thinks. And he can make his own decision, because obviously it's his body, not mine. And we shall see. We shall see what the Lord decides too, because it's not just what we want. I would prefer him to do it naturally and just eat healthier and like work out. I wanted to join a gym. I wanted to work out. I think that if he worked out daily, it would be fine. He has a sit-down job. Sit-down jobs are the worst, because then you have problems with circulation. You end up with neuropathy. You end up gaining weight. So it's like, it sucks. We got to find a balance. My dad always said to be a pencil pusher, right? To not work so hard. You know, work smart, not hard. But also working smart can also lead to problems. Every job has its problems. If you're outside working, you get sunburned, you get dehydrated, you can have a heat stroke. If you work inside, you got to be careful. If you stand too much, you end up with bunions. You end up with problems with your legs too. If you sit down too much, it's the same thing. So everything has a risk. We just have to be mindful and pay attention. And unfortunately, they have us working so crazy and just stressing out about meeting all these bills and all these things that we're not thinking clearly. And then the food they give us or the food they offer us, if it not managed correctly or we don't balance it properly, we just end up with other problems. So we live in a great country that provides everything for us, but we need to know how to manage it as well. And so we need to ask for a higher power to step in and help us make the best decisions. So my job now is to always start with the Lord first. And that's what I wrote about yesterday. God first. Talk to him first in your day and ask him for the help that you need. And ask him to speak to you and to try to help you. Try to help you get through your day and make the best decisions you can. And you got to allow him to take over, because you can't control everything. This is something I've had to learn. Can't control everything. So anyway, that's my message. I'm here at the hospital. I've been doing this video at the hospital. I'm staring at it right now. And so I'm ready to walk in. I have all my stuff. I have my food packed. So I appreciate everybody trying to some of my friends reached out to me and asked me if I needed food. I said, I packed my food. I have my food. I appreciate other people trying to bring me food, but because I've done this countless times before, I try to come prepared. And so thank the Lord, I have food right now and I'm grateful. So I just packed some protein yogurts, and I brought some of these So this is, I brought a fruit. I could have brought a cookie. I have a cookie at home, but I didn't. I brought some fruit. I brought this yogurt. I made my kids breakfast this morning. I made them some chorizo neck tacos. I brought blueberries and some nuts with a little bit of granola. And yesterday I did bring some cheese. Today I didn't. So this is fine. And then hubby hasn't really been eating like all of his food on his own because he's been having like that nauseousness. So I'll like pick a little bit at his food if I like it or whatever. Like yesterday I took 2 little pieces of meat because he didn't really want a lot of meat. And so I just pick at that. I took a little bit of like a cauliflower and I was fine. So I'm trying not to overeat. I'm trying to be mindful when I'm here. I don't want junk food. Trying to be in a place like this makes you think to eat better. This yogurt that I have, this is the one that Dr. Valencia on Facebook recommends. It's like this, and it has like 20 grams of protein. And so I have this one. Before I used to have like the Chobani. And then I have my journal where I've been writing my scriptures, and I just have all the stuff that I usually carry in my purse. But this time I did bring my husband's bag because I do have the iodine, the wound cleanser. I have the blood pressure machine. I have gauzes. I have tape. I have hydrogel. I have all that stuff there because I'm going to go and treat his wound before it turns into something else. Right now he has 2 insulins going. They controlled his blood pressure. He's doing fine with that. Like I said, I'm grateful for all those things because obviously they need to calm him down. He was a mess. They gave him some medicine for like in the ER. They gave him some medicine for like the nauseousness and stuff. And they've been able to control the fever. So I'm super grateful. He's in the right place. I appreciate all that. But this wound is not going to get the best of me. I've treated a lot of these before. And so with iodine and hydrogel, you can cure any wound. Don't let anybody tell you otherwise. You can. And I always try to tell you guys this. I hope it helps somebody. Buy some iodine. Let me show it to you real quick before I get down. You can buy it at Lee's Pharmacy. I'm not sponsored or anything. I don't freaking get anything from telling you guys these things, but I want you guys to, like, if you're having a problem, I'm hoping that this will help somebody. So I brought my husband's glucometer machine. I have a blood pressure machine. I have like 3 of these, but only this one I brought with me because it's small. And you can get these at H-E-B. So if you need something like that, something small that you can carry. And this bag I started carrying because, like, when we were taking care of my dad, we always had to carry like stuff like this for him and stuff. So my brother and I learned that. And so we carry this. This bag might seem like a little bit of a mess, but it's just all the iodine that sometimes it kind of like slips out of the thing. So this is the iodine. This is, let's see. This one you can get at Lee's Pharmacy. This is what it looks like. It looks like this. It's kind of like an orangey yellow color. So I learned this from Dr. Gerald. Dr. Gerald was Rudy's wound specialist. And so he took care of his hand. They did surgery on his hand a while back, and he took care of that. So I have a lot of faith in Dr. Gerald. He's amazing. I know a church member that works, well, I don't know if he still works there, but he worked with him. And so he's just so amazing. These are just some Q-tips that I carry when I apply stuff to the wound. These right here are some iodine strips. Okay, these are some strips. Sometimes they dry out, so you might need to buy some new ones. This is the hydrogel that I talk about. This is aloe vera, and it has like, I guess it's infused with oxygen. So this really, really helps. So this is what I used to carry all the time. And this is what we started treating my dad's wounds with, and all of them got healed. So you always you wash the wound with soap and water, and then you pat dry it with a gauze, and then you apply the iodine first, and then you do the hydrogel on top of it, and then you close it up with you cover it with a gauze. And so you can get these gauzes at H-E-B. I mean, you can get them at pharmacies and stuff. I just think H-E-B is a little bit cheaper, or Walmart. You want them to be, let me think of the word. You want them to be sterile, basically like in a package. You don't want them to be open. You don't want to have any type of bacteria or any type of, anything entering the wound. And so even with pressure ulcers, my husband has had pressure ulcers like on his pinkies before, or also like on his ankle. He's had them on both ankles. One of them did have to be debrided by the doctors because he applied so much pressure in it that they were worried that it could have gone down to the bone, and they try to remove all the top layer because if not, they can't get to the healthy skin at the bottom. And I totally get that. But so he's been debrided prior. He's had his toes debrided, his ankle debrided. So I already know that process, which is fine. But really, I've learned with my experience without coming to the doctors and stuff, where I had to manage things, that if you keep applying the iodine sinks into the skin, and that hydrogel, because it's aloe vera, it really helps. You can also do regular aloe vera, but I just really like the hydrogel because it has that oxygen. And the other thing that I did was I started massaging that area. So I have I won't do it with like a really strong vibration, but I will do it with a small machine that causes circulation around the wound. And so with my husband, whenever he has a wound, I always make sure he walks because he needs circulation. He needs that blood circulating and moving. And so, yeah, those are some of the things that I brought with me. You always want to have a pair of scissors. I was going crazy looking for scissors this morning. I have other scissors, but I wanted something lightweight, so I brought some scissors. You want them to be sterile for the most part, or just clean them. Clean them with alcohol. Clean them, wash them under the sink or whatever. I don't know, but it's with soap and water, but you need that. I always carry tape. I always have like gloves and tape. I always have this stuff. I have to have like my own emergency kit because this man of mine has always put me through these things. So I have everything for him. I even have one of these pulse oximeters because we needed them with my dad. And so you can also get it at HEB. It tells you your pulse rate, and it also tells you your oxygen level. And so I needed this with hubby when like he had COVID or mostly COVID. And so I always had to constantly be looking at his oxygen level. And so I have everything I need, like I said. And, the Lord provided this experience. And so, yes, I might not have a million titles. I was a medical assistant and I was a patient care tech. I worked at nursing homes for several years. I ordered all types of supplies for the nursing homes. I have a great deal of experience. I am a stay-at-home mom now. I do work from home now a little bit here and there. We order supplies and stuff like that. Still with the supplies, for some reason, the Lord wants me working with supplies. But like I said, I have the experience, and I know who helps me through all these things. And so I'm not worried. I'm not stressed out. I'm just kind of like, oh, I missed it. And so I just need to go and take care of business and allow them to do what they need to do, but also step in and get this stuff applied quickly before they want to tell me there's an infection on the bone. That's the worst thing you can have with a diabetic, that they want to start chopping away at people's feet or arms or stuff like that. And I get it. They got to contain it. But before we get to that point, we need to take care of it quickly. And so iodine is super, super good. Read up on it. You don't believe me? Read up on it. You'll understand. I've treated countless wounds. So take that experience. I'm giving it to you, and I hope that it helps you in some way or somehow. Buy the iodine, but do it yourself. There are things that you can do for yourself. You don't have to wait for people to take care of it for you. And that was a lesson I learned with my dad. I was waiting upon people to serve him when I could serve him myself, because I already had the knowledge, but I expected them to do it because I was at a hospital. But really, you can do it. And sometimes your back hurts, and sometimes you think you can't do things, but God provides all of that for you. He gives you the strength. I picked up a 300-pound man. I picked up a 200-pound man. He provided me the strength that I needed. When my brother thought I couldn't do it alone, I showed him I could do it alone. When everybody left. Like I had, I'll just share this one more experience and then I'll let you go because I gotta go. So, my aunt had reached out to, a stake president from our church, and he worked at a hospital, and we needed a bed for my dad. I'm sure you guys can see it, or I'll try to post it later. We needed a bed for my dad that would go up and down because our backs were already busted in. We just couldn't do it anymore. It was just too much. Doing it for 6 to 7 years of rotating, changing constantly 3 times a day was a lot on our backs. And so I couldn't do it anymore. And my brother was already the same. My mom was also, we were just messed up and we needed a bed. And so God provided, and the stake president helped, and he stepped in. He worked at a hospital. He helped us get a bed. We got a bed. And when we got that bed, I didn't know how we were going to put it into our home because it was very heavy, and it's a heavy bed, right? It's like one of the ones that, like the ones here at the hospital that lift up and come down. It's a big bed. And my brother, I don't know how he did it or whatever, but my brother is pretty strong. My brother Roy, not my brother Rudy. My brother Rudy was hit with COVID. And so he had to leave. He left because he felt really sick and he thought he was, I don't know, he was just done. And so he had an apartment at that time. And so he left because he was supposed to be in isolation. He had COVID. He was feeling so sick. So he just left. And I'm like, now what? What do I do? So I did what I could. I asked God to please help me to find a way to get this bed into the house because my other brother, like I said, my other brother, Roy, he and his wife went to go pick up this bed and put it on a trailer. And so they brought it to the ranch and they were supposed to help put it in, right? And so, but we were not going to do it. We were not going to be able to do it alone. And so I was just thinking, I'm like, what do I do? What do I do? Who do I call? The missionaries I know here are not in the same jurisdiction or the same area that I could ask for help, right? So I had to reach out to a sister missionary on Facebook, and I said, hey, I don't know if I saw that she was from Mission or whatever, but I loved her beautiful picture. I loved her beautiful smile. And I said, hey, do you know how I can get some missionaries to help? So these are missionaries from our church, and these are all young missionaries, men, but they were strong. She's like, I have some friends. I can totally give them a call and let them know that you are in need. And I said, please, thank you. And so she sent, I believe, 4 missionaries that came over to our ranch that day. And I just felt such a sense of relief because they were coming to help. And so they came and with their smiles and they said, we're here to help. I'm like, I didn't want to give them a hug because I knew I was sick. And I didn't know if I had COVID or not, but I was sick and I didn't want to get them sick. And they're like, oh, it doesn't matter. It's fine. And I'm like, no, you don't understand. I don't want to get you sick. And so he's like, no, you're fine. And so with so much love and so much smiling, and my brother was there and I was there, and I think my husband was there, and I think my son Remy was there. We all put this bed sideways, and we were struggling because it was really heavy. We put this bed inside a really tight space because my mom's house is really small. It's like a 2-bedroom. It's small. And so we were having to put my dad in the living room area. And so anyway, sorry, somebody came in front of me. I don't want her to think I'm videoing her. And so I'm trying to be mindful. And so anyway, so we get this bed we were having to slide it at the entrance. And so we get it in. And so we managed to put it the way it's supposed to be, right? The proper way. And so we picked it up. And so it was like that. And so my dad was sitting on a recliner that my Aunt Raquel had gotten for him. And so he was sitting there, and we had all these tubes and oxygen going and everything. And so he had a bunch of stuff on him. And my brother, the missionaries asked, do you need anything else? And I said, well, yeah, to help me transfer my dad to because I didn't have my brother Rudy, and I know I couldn't do it alone because he was sick, and I've always relied on my brother Rudy, and I didn't have him. He had left. And so anyway, so I tell my brother Roy and the missionaries that if they can help me transfer him over. And my brother Roy stopped them and he's like, no, I'll help you right now. Like, they're done. They're fine. Like, don't put them through that. And they were just kind of like looking at me. And so they're like, okay. And so they ended up leaving and my brother Roy said bye to them. And then my brother Roy just took off. And so I was like, now what? My brother Roy said he was going to stay to help me and he just left. I don't know if he forgot or I don't know, but he just left. And so now I'm like, now what? My mom was too weak to do it. She was older. You know, the provider, she was new. And I had asked God to send me peace and he sent me a lady named Bas. And so this lady, it's not her job to do. She helped. My mom helped. And I think my kids helped. And so between me, my mom, the lady named Bas, and my kids, we transferred my dad over, but I was the one leading. And it was usually, I would always let my brother lead because I trusted him. Even though he didn't have a title, I trusted him because he was so strong. And he saw things that others couldn't. He could see, he's kind of like me. He's very stubborn. He can see other people's mistakes quickly. He can think, you can trust him. And, he's there. He's available. He makes himself available. So that's why I say you don't need to have a title. You need to have experience, willingness. You need to have sense. So anyway, we did it, because God helped me. I'm like, God, please help me. Help me transfer my dad and nothing bad happened to him because the last thing I want is for my brother Rui to get mad at me and think I can't do it. And something to happen to my dad while I'm transferring him. And so we did it, I was like, we're going to do this and we're going to do this and we're going to do this. So I've had the opportunity to be a follower and I've had an opportunity to be a leader. And so I know the difference between both. And I know that sometimes you got to lead and sometimes you got to learn to follow. And so when you can learn those types of things, you will get pretty far. And so I don't try to criticize when I say things. I try to come from a place of experience. And so I hope that I never offend people when I try to speak up. I'm just gifted in that sense for some reason. I don't know if it comes from God or what, like you got to speak up and say something. But my brother has the same thing. And so I had that experience. And so I know God provides, like he provided those missionaries that day. Like he provided that bed that day. And I come with a ton of other stories. But I got to go now. I hope that this message helps. I don't know. God wanted me to say it. I felt the need to say it. So I might not be at church today, but I'm here serving my husband. And I want people to understand that just because people are not at church doesn't mean that they're not staying close to God. I stay close to God. I know where my heart is. And I know who I can trust. So remember that. Don't think bad about people who are not at church. Sometimes they're going through something. But it'll pass. And they'll be back. Be kind. Love them. Support them. Invite them. But always be kind. I don't know how many times I have to say that. Always be kind. So anyway, I gotta go. I gotta go take care of my husband. I gotta go take care of business. And try to be kind to myself. Because sometimes we fall short in that. We constantly have to be catching ourselves on that. You might have a lot of experience, but you also need to be kind. So anyway, hope that helps. Know that this was planned from above. I had to say it. And there are a few other things I wanted to share, but sometimes I get too caught up in my thoughts and I'm like, oh, I'm not dressed. I don't look right or whatever. And I just don't do the videos. But I've had a lot of promptings to do videos and share certain messages or share funny things that happen and stuff. And so, I don't know, hopefully this helps you in some way or somehow. And if not, it's just an update for you. Hopefully you get to see a little bit more of my life and how I am and where I come from. And why I share the things that I share, because I want to uplift people and always help them at the end of the day. So be kind, be nice, be mindful, love people. Because it's very easy to offend or feel offended. And so, yeah, sometimes you got to step beside yourself and try to just, put yourself in other people's shoes. And yeah. So anyway, gotta walk in now. Gotta go walk those halls. But I know where the elevator button is now. So I'll talk to you guys later. Bye, guys.